Is your dog having diarrhea? This is a common problem that veterinarians see on a day-to-day basis. Diarrhea is a word that we use to describe increased frequency and wateriness of stool. Other clinical signs that can go along with diarrhea are flatulence or passing gas, increased volume of stool, blood or mucus in the stool, and straining to defecate. This condition is a result of a failure of the gastrointestinal tract to do its job properly. It normally involves some sort of inflammation or injury to the small or large intestine. Fortunately, some cases of acute diarrhea are not caused by serious medical problems and can be treated by a VetPronto veterinarian in the comfort of your own home. Some of the things that can cause this type of diarrhea are eating garbage or unfamiliar foods, a diet change, minor viral, bacterial, or parasitic infections, and even anxiety or stress. In these situations, a fecal analysis testing for parasites should always be considered. Treatment will likely involve a bland diet and some medication to begin treating the diarrhea. If parasites are diagnosed, more medication will need to be dispensed by your VetPronto veterinarian. A follow-up fecal analysis will need to be performed a few weeks after medication is discontinued to ensure that the parasites have been eliminated. In other situations, bouts of diarrhea may be the first signs of a more problematic condition, or even an emergency requiring immediate medical or surgical intervention. Ingestion of a toxic or poisonous substance is life-threatening and will likely require hospitalization and days' worth of treatment to decontaminate your pet. A gastric or intestinal obstruction caused by a foreign body may require immediate surgical intervention. In dogs, stuffing from plush toys or cloth material are some of the most common foreign bodies we see. For this reason, they should never be left unattended with those items. Serious viral infections, especially in puppies such as parvovirus, will likely require hospitalization. Serious bacterial infections like salmonella from eating things like raw food may also require days' worth of hospitalization. Certain types of chronic liver and kidney disease can also cause diarrhea and may stabilize once the disease is managed. Pancreatitis is another condition that can also cause diarrhea, and you'll likely see vomiting at the same time. This may require hospitalization, or sometimes it can be treated at home. Inflammatory bowel disease is another possible cause. This will likely require a diet change and lifelong medical management. Cancer of the gastrointestinal tract is another serious disease that we see causing diarrhea in older dogs. One of the most common cancers of the gastrointestinal tract is lymphoma. Prognosis can vary greatly depending on the type of lymphoma, the location of the lymphoma, and how it's treated. As you can see, there are many causes of diarrhea. In many of these cases, tests will be necessary to diagnose your dog's diarrhea. Many of these tests can be run off of a simple stool sample. However, in some cases, your dog may require x-rays, an abdominal ultrasound, or biopsies taken via endoscopy or surgery. If your dog has one episode of diarrhea or it clears within one day, you likely don't need to see a veterinarian at that time. However, if the diarrhea persists or other clinical signs such as vomiting, weight loss, a fever, lethargy, depression are involved, you should consult a veterinarian. I also recommend that if your puppy is having diarrhea, you contact a veterinarian immediately. These conditions can often progress rapidly. I hope you found this video to be helpful and informative. Thank you for watching. Book your dog's VetPronto home visit simply by visiting our website at vetpronto.com or downloading our app from the Apple App Store or from Google Play.